right, thanks so much. So my name's Jackie Christensen. I'm a nurse practitioner, and we're going to be going over the Baxter Sigma pumps today. So the way that we typically do these is I have a PowerPoint that we'll go over that's a visual of pictures of what types of things you'll be seeing when you use the pump, and then I'll actually do a live demonstration. So I'm going to go ahead and share my screen, and we have our pump. So this is just what the Baxter Sigma pump looks like. We'll go over briefly what your tubing is going to look like for this particular drug demo. You're actually going to be using blood tubing. So you've got filter tubing here, and you've got 2 spikes on the tubing. We'll go over how to fix this because you're only going to be giving 1 bag of fluid, but you've got 2 spikes here. So we're going to clamp off one of these spikes. Like I said, typically this is actually blood tubing, but we use it for the filter mechanism for the drug trial. So as with any other tubing you may have seen before, you've got your spikes, you've got your drip chamber, you have this key right here. This blue key is going to be important to the use of this pump. You have your roller clamp, and then you have your cap that goes to the connects to the patient. So step 1, prime the tubing. This is exactly the same way that you would do it normally. So to prime the tubing, you're going to close both of these roller clamps at the top, the 2 spikes for the bags. You're going to spike the bag that you want. Make sure that you leave the one that's unspiked closed. I'll show you why when we go over the thing. It'll leak is the long and short. You want to open the one, however, that is spiked to the bag. Priming the tubing by squeezing the drip chamber as you normally would. You want to make sure this little ball in the top part of the chamber is floating over this mechanism at the bottom. The ball will occlude it, actually. So if this ball isn't floating and you don't have enough fluid in that chamber to make the ball float, it's going to have upstream occlusions on the pump, which we'll go over when we actually deal with the pump, and your mechanism's not going to work. So make sure this ball is floating. Prime the tubing, open up the roller clamp, the distal roller clamp as you normally would to prime your tubing. Now on the top of the pump is a key mechanism. So this blue thing that I mentioned that's inside your tubing is actually a key. You'll notice there's a little divot kind of on the right side of it that corresponds to a divot in the key mechanism here. It only goes in one direction. If it doesn't go in the direction you're trying to put it in, flip it over, try it the other direction. So you insert the key into the pump, and it'll actually open this door. Just like that. Then you put in your tubing. So there are some numbers here. There's a 2, a 3, and a 4. It'll give you 3 check marks when it's pushed into that channel effectively. So the pump will actually tell you when the tubing is in the right position. And we close the pump door. So the red keys are your soft keys. So the soft keys behave as they indicate on the screen. So for example, the second soft key right here is an up arrow. The soft keys change in what they do based on what the screen directly above it tells you what they're doing. So step 2, using the pump. Use the soft keys to scroll up and down as needed, highlight general care, then push the OK button. In the drug name screen, just push OK. So normally these pumps actually have an entire drug library that's populated for them, but this is a clinical trial drug that we'll be infusing, which isn't yet part of the libraries that Baxter provides. So the libraries will be completely empty, and you'll just select a blank drug name here. So using the soft keys, you'll want to scroll down to the word basic here. So you'll scroll down to basic and then push OK. In basic mode, you'll select the primary bag using soft keys and then press OK. So up and down as need be. So using the pump, for first thing we're going to do is it'll go from top to bottom. So we're going to start with rate in milliliters per hour. You will infuse 500 milliliters. per hour because we're doing 250 milliliters in 30 to 45 minutes, which is the drug trial rate. So you want to put the rate in as it would be in milliliters per hour, as with most pumps. The volume to be infused is, as usual, VTBI stands for volume to be infused, is going to be 250. The time will automatically populate, and it'll tell you 30 because you can put 250 milliliters in at 500 an hour in 30 minutes. And then the volume given at the bottom is, if you were to interrupt this midway through, it'll tell you how many milliliters has been infused through the pump at that point. So double check everything. Like I said, the time will automatically calculate, the rate will automatically calculate based on what's already been through the pump. That should be 0 when you first start these infusions. And then you're going to push the run stop button to make this start. Now, as with any other pump, open your roller clamps. I'll show you another place that's a common place that's tripped up with these particular pumps, because the key that you use to open the pump is actually also a clamp for the tubing. So you have to unclamp where the key clamps the tubing, and you also have to unclamp the distal roller clamp that you use to prime the tubing. So when you hit run stop, it'll have you double check, make sure all the keys are open. So it actually highlights on the screen this blue key. We have to open that. It'll prompt you to check and make sure drops are flowing as you normally would with this type of pump. And then there's a couple of problems you can run into. So downstream occlusion means an occlusion that happens after the pump, so below the pump line. If it's occluded by the roller clamp, for example, if the IV is pinched from the patient bending their elbow, things like that. The solution is to just remove the occlusion, and the pump will actually automatically restart. You don't have to hit any buttons to make it restart or anything like that. Problem number 2, upstream occlusion. Almost always this clamp. When you use this clamp to open the pump, this is the key, it'll clamp your tubing. Make sure you unclamp it before you start your infusion. The second most common thing for this to be is that ball. So if that ball isn't floating, you'll have upstream occlusions from that. This one, if this happens, you do need to hit the run stop button again to restart the pump. And air in line. So these particular pumps are a little bit particular about how much air they will tolerate in the line. Small air bubbles can be a problem. Common causes, the IV bag is empty, bubbles have entered the drip chamber, stuff that's typical with any pump. So solution number 1, if the IV bag is empty, obviously stop the infusion, you're done. If solution number 2, you can open the pump using the key, remove the tubing, and reprime it. There's not really a good mechanism to save drug, unfortunately, when that does happen. There's just not really a way to use a syringe to reprime your tubing as some other tubing brands use, and it's just not really possible with this tubing, unfortunately. So that is the pump. Does anybody have any questions about the basic, just like how to with the pump?
No.
All right. Well, I'm going to go ahead and do a demo then. So we're going to start by priming our tubing, which I've done before the fact. So the unspiked bag is closed. I'm going to open my spiked bag. My ball is floating in the chamber, so it's above this halfway mark here. And the rest of my tubing is all primed. So you don't actually have to use the on-off button to turn this pump on. You can just insert the key. And again, it only goes in one direction. So if I try to put it in backward, it doesn't go anywhere. And it'll tell me load into guide number 2. There's a number 2 right here in this channel. So I'm going to push this into number 2 and then load into guides 3 and 4, number 3, and number 4. So numbers 3 and 4 can be a little fussy. You just have to kind of use your finger to push it a couple times. We'll close the door when it tells me to close the door. And I'll take the key out. Still not in properly. Oh, it must have slipped out. Sometimes that happens when I think I need to reprime this tubing, actually. Spiking our bag. I'm going to use my distal roller clamp to occlude it. There we go. I'm going to squeeze my drip chamber a few times. The drip chamber is sizable. It takes quite a few squeezes. Our ball's floating. We'll unclamp everything. There we go. That's much better. Our tubing is all primed. I'm going to put the key back in. Load into guide number 2 and number 4. And we'll close the door. And we'll pull the key out. All right, so I'm not sure how well you guys can see the screen, but the one that's automatically selected is general care, like it. Okay. There is no drug library, so I'm going to just hit OK. I'm going to go down to basic and hit OK. And it'll automatically select primary bag. Now, if this were a clinical setting where you were giving somebody IV fluids and you wanted to give them, say, an antibiotic over 30 minutes, there is a way to program that. We're not going to go over that in this demo, that said, because it's not relevant to the drug trial. So we'll hit primary bag, and we want milliliters per hour. We want 500, so we'll do 500. Okay. 250. Okay. And then we'll go ahead and hit run. So I have not yet unkinked my tubing. So it's saying downstream occlusion. I'm gonna open the roller clamp back up, and it automatically starts going again. I'm gonna tell it, yes, the drips are flowing. And that's that. All right, so I'm gonna pause and ask if anybody has any questions at this point.
Not really, but the second thing that we can attach to a bag, we can keep it if we need to put NS after, or
yes, you can definitely do that.
We can use this one. And we really need to it's not the pump that's priming, it's really we need to prime before putting in the pump.
Yes, you need to prime before putting it in the pump.
Okay.
All right, any other questions?
Jacqueline, I know that it's Tanya here. I know that last time you mentioned the things that are likely to happen, and the most common problems that you have with the pump and how to fix them, and cleaning the pump also, which I know is just a wet wipe, but maybe you can explain.
Yes, so the most common thing to happen, as with almost any pump really, is the downstream occlusion, which is the patient has bent their elbow and their IV is kinked off, or their we forgot to open the roller clamp back up after priming the tubing, or things like that. And the pump will automatically solve those once you've actually solved the occlusion issue. The second most common thing that I see people do is when they have an upstream occlusion, often it's because they forgot to unclamp the key after using the key to open the pump. So just double check and make sure that you've opened the that you've taken the clamp mechanism off of the key when you're done opening the pump. Those are the most common things that I see. These pumps are really pretty straightforward as far as their functionality goes. I don't see a lot of drug library errors, for example, aren't relevant to this, or I don't see a lot of mechanical issues with the pumps themselves. As far as cleaning goes, just a simple hospital wipe is completely fine, and you don't actually need to do the internal mechanisms of the pump. You just want to touch you just want to do the surfaces that you touch. So the mostly the buttons, the on-off button, those areas of the pump.
Okay, thank you very much. Yeah, I got those questions at some stage. How do we clean the pump? But because it's the closed circuit, there is no real cleaning needed. But I know that some nurses requested that. I don't have any further questions. Kenna, Sandra, anything from you, or
Yes.
is everything clear?
No, everything's clear for me.
Yeah, if you do clean the insides of the pump, make sure that you use something that doesn't leave a residue. Sometimes I have seen the residue from using cleaning solvents and things like that on the interior mechanics of the pump can sometimes make the pump think that there are bubbles in the tubing that aren't there. So if that happens to you, just take an alcohol wipe and just run an alcohol wipe through the channel, and that she usually clears it up.
Okay, and thank you very much. I know that the
All right.
this was recorded. Jacqueline, if you can share that with Lauren, that would be great. And then it will come my way. Thank you very much for arranging this on such short notice.
Thank you very much.
Okay. Okay. Good luck and thank you, and have a nice evening.
You too.
Bye-bye.
Bye. Thank you. You all too.
Bye.
Thank you, everyone. Bye.